Hello, and thank you for tuning back into Givens Facial Plastic Surgery. This is Dr. Givens as always. I'm going to talk to you today again about exosomes, but in a very different procedure. This is for non-surgical hair restoration for hair loss. In my prior episode or recording, I was talking about exosomes for skin rejuvenation concerning the exosome facial, which is a wonderful treatment, and if you'd like to learn more about it, you should go and review that recording that I've done for you. Today we're going to talk about hair loss, which affects both men and women globally, whether it's from stress, genetics, whether it's thinning of the hair, or patches of hair loss. This treatment is very cutting edge and it's non-surgical, meaning that you do not need to undergo the knife. There's no general anesthesia involved. It's a quick in and out procedure in the office that takes about 30 minutes to do. And I'm going to go through it with you and even show you a live recording of the procedure that I've done on a patient of mine. Exosomes are not cells. They do not contain DNA. They're actually nanovesicles that work by cell-to-cell signaling. And so when they're injected or infused into the body, they signal to cells to help your body's response in repairing and regeneration, whether it's for skin rejuvenation or for hair growth. They're both great. Patients will generally see a large effect or hair growth at about the 2 to 3 month mark, but even at that 1 week and even at 4 to 6 weeks, you will start to see some good hair growth from your patients. It really is the real deal, so stay tuned and you can see a live recording of one of my patients getting a front half or temporal hair restoration procedure. Again, if you need anything from me, my office number is 737-787-8200. You can also check out my website, www.givensmd.com, and we look forward to seeing you in the future.
This patient of mine was interested in non-surgical exosome hair restoration for the front half or temporal area of his hairline. He was noticing progressive thinning and was interested in hair restoration via a non-surgical procedure. After thoroughly cleansing the scalp, I will then draw up and prepare my exosome solution for injection. Prior to this, I will have already numbed the patient's scalp so that the procedure is painless. As you can see here, I will begin injecting in small aliquots my exosome solution throughout the scalp, and particular into the main areas of thinning. As this patient wanted a temporal or front half hair restoration, these are the areas that were of focus. I will then use my micro stamper to allow for creation of micro injuries and hair regrowth and density. If you are interested in hair restoration with exosomes, please give our office a call.